Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's up, people? This is Dr. Angela, everyone's favorite OBGYN, and today I would like to welcome you to episode 199 of the Ask Dr. Angela podcast. Today I am honored to be graced with the presence of Jaime Malone. Jaime is a licensed professional counselor with her focus being on maternal and child health. Welcome to the show, Jaime.
Thank you, Dr. Angela. I'm so happy to be here.
And we're like over the moon happy to have you here. So just what exactly does that mean? What does it mean to be a licensed professional counselor with a focus on maternal and child health?
Yeah. So a licensed professional counselor is someone who works in the world of mental health and might work in all different types of domains. My specific area is maternal and child health, really because, quite frankly, moms are the health of the family, right? So maternal health, in turn, affects everybody's health. So maternal health is the whole lifespan, right? Mm-hmm. From pregnancy, even before pregnancy, right? Trying to conceive, whether dealing with infertility issues or planning for pregnancy, the pregnancy itself, and then motherhood, early stages of motherhood, and everything beyond that, everything that life throws at you from there, right?
That's absolutely right. So you kind of just led into my next question for you, focusing on the type of support that you provide to a mom that's, number one, planning a pregnancy or that's currently going through a pregnancy. What kind of support do you give?
Sure. So counseling is really an opportunity. We know there's so many other ways that we take care of our wellness, right? Everybody gets the idea. You need to go to the gym. You need to get physical exercise. You need good nutrition. All of these things for our overall wellness. Counseling is really just an opportunity to look at our mindset, our moods, our behaviors, and how all of these things affect what we're working so hard to try to have in our life. So counseling is a time really to stop and pause and think about these things, because so much of the rest of life we're busy just doing.
Yes.
And the counseling relationship gives you somebody who is just all about you, right? And can really pay attention to your needs, your way of thinking, how you experience the world, what your stressors are, what your strengths are. And so particularly related to pregnancy and a time of great change, even a positive change, brings with it huge questions, huge stressors, huge new things that people haven't experienced before. So counseling is that time to stop, reflect, think, consider, and sometimes gain some new skills, new perspectives in navigating those awesome things.
Absolutely, because one of the things that I find, even in going through my own pregnancy, first of all, the changes that your body is going through. And I mean, one of the songs that I play on my guitar, Carly Simon, You Are So Vain, that was me, so vain. And I specifically remember when we first got pregnant, at like 5 weeks, I could not fit any of my clothes. And my wife and I commonly share the story because she walked into my closet one day and I was just sitting in the middle of the floor and I was just bawling. And she's like, Ange, what's wrong with you? And I'm like, I can't fit any of my clothes anymore. And, your emotions are all over the place. Yes. I had to get an entirely new wardrobe. And again, please excuse the vanity on this because it's very important for me to look my best. I gained like 55 pounds during my pregnancy. I had never been a mom. I didn't have any nieces and nephews. None of my friends had kids. So it was a lot going on. So I think that you're absolutely right. I think that more people probably should be in counseling, even if you don't think that you need counseling, because a lot of times it's just good to be able to verbalize.
Absolutely. And that's the thing. Counseling is really a wellness activity.
Yes.
And I think a lot of times when we think about mental illness, we think about pathology. We think about that you have to have something wrong with you. Or even sometimes it's like, well, it's not that bad. It's like, let's not have that be our reference point. Like, let's not wait till things are that bad. Let's talk about wellness and all of those wellness kinds of habits. So even when you talk about your own journey, that's so common. That's so understandable.
Yes.
But when you are able to put that in a bigger picture or put that in a context or even do some reframing around it. So body image issues are a huge thing during pregnancy, post-pregnancy. Even though we know our body is going to change, actually dealing with the reality of those changes can create a range of different issues. So I even try to help moms focus on, okay, let's look at what your body is doing, less about what your body looks like. And if you can connect with a source of pride, like, wow, I am growing a human being, or even after the fact, like I birthed a human being, or for women who choose to breastfeed, I continue to nourish. And so even that kind of focus, like let's focus on what your body is doing. And then let's get you back to where you want to be so you feel good about yourself. And then continuing to find other ways that you can feel good about yourself during these other changes too.
Absolutely. So one of the things that I really like that you mentioned is preventative medicine. And I'm a huge lifestyle, proponent. And, diet and exercise, I never ask patients, about dieting. I ask, how is your diet? Because it should be something that is just a part of who you are. So I like the idea of you, presenting counseling in a light that's to make you better and to keep you better.
Absolutely.
So that's a really good point. One of the things that I see a lot, obviously because not only do I do gynecology, but I'm also an obstetrician, so I deliver a lot of babies. But one of the things that I'm constantly screening for, on the lookout for, is postpartum depression. And one of the things that I'd like to talk about is postpartum depression. First-time moms feeling overwhelmed. You're tired. You're not getting any sleep. You've got a baby that's crying. You don't feel like you have all the support that you need. One of the things that I commonly say to women that I see on a daily basis is most women, whether or not they're willing to admit it, feel or have felt the exact same way that you do at some point. And one of the things that I say to my pregnant moms, which everyone is afraid to say because, oh my gosh, pregnancy, is so wonderful. It's so beautiful. But I say, you know what? Damn, pregnancy is hard.
Oh, yeah.
It's hard. And being a mom is one of the toughest jobs in the world.
Agreed.
And so when I see women and I'm getting to know about you, because I like to know about you and I find out what you do, when I meet moms that say, oh, I'm just a stay-at-home mom, I'm like, no, honey, you are a stay-at-home mom, but that is a huge job. Because I did that. I took a year off when my daughter was born to be a stay-at-home mom. And let me tell you, I was ready to go back to work. I missed the conversation, the real TV, the real activities. Because when you're a full-time mom, not only are you taking care of a kid, but you're maintaining the house, you're doing the grocery shopping. I always tell folks, you're not just a stay-at-home mom. Your job is invaluable. And I tell all of my moms that stay home, you are busier as a stay-at-home mom than I will ever be as a full-time obstetrician gynecologist. And I'm busy.
And that's amazing. Right?
I'm busy.
Yeah.
So let's talk about a couple of things with postpartum depression. Number one, who's at risk? And how do you know if you're suffering from this?
Great. So first off, thank you for having these conversations with the women that you see, because it is so important. So statistically, it's said that 1 out of 7 women will suffer from postpartum depression. And I say, even if you're the 6 out of the 7, you're going to face so many of the things that you just spoke about, right? So I put that statistic out there just for people to know how common it really is, what we're really talking about. Because, as you mentioned before, a lot of women feel like I'm the only one, there's something wrong with me, or even sometimes well-intentioned people around a new mom will say, it'll get better, it goes away, and hopefully it does get better, but we don't want to neglect what's actually happening at that time. So postpartum depression, and the one other thing that I want to say about that is postpartum depression can actually even present during pregnancy.
Yes.
Because sometimes I see women and they say, well, I know I haven't had the baby yet, I'm still pregnant, but this is how I'm feeling. So all of these changes, and so just, the title unfortunately throws people off a little bit, and just for women to be aware of that too. It's not just post the baby's arrival. So who's at risk? Anyone and everyone. I mean, just to know that. It's not a certain demographic. It's not if you have a certain education level that you are immune or that you're more at risk. We see this cross-culturally. Every population, every age, it's an equal opportunity experience. So here's what else we do know. There are certain things that might make certain women at greater risk.
Yes.
Women who have suffered from either anxiety or depression in the past might start to notice that some of those feelings come back. Not absolutely, doesn't mean that it's going to have to happen, but that's sometimes one of the things that we do know. And then a lot of it has to do with what resources and what supports a woman has in place. So that's the good thing, too, to know that there are certain things that can help buffer against the experience of it. But any age, no one is immune to it. And I say that just for women to also hear that, because I've worked with labor and delivery nurses who've said to me, but I'm a labor, how can I be having this? These are the women.
Yes.
I said, wouldn't it be lovely if that protected you from this experience? Wouldn't that be lovely if that made you immune from this? But it doesn't. So just for everybody to be aware of that.
Yeah. That's a really good point. And so what I like that you mentioned is people that have had a history of depression are certainly going to be at an increased risk for this. I find that my really young moms, teen moms, and those moms that don't quite have all of the support that some other moms might have, or some of the resources that some of my other patients might have, those folks are at an increased risk. And another really big one is when moms are not able to come home with babies that end up in the nursery or in the NICU for extended periods of time. Those are moms that you want to keep a really close eye on.
Correct.
But like you said, this can affect anyone. It doesn't matter what color you are, how old you are, what your socioeconomic background is. This is something that's very real. So the other thing that I'd like to ask you was, what resources are available to moms or to women that are experiencing this?
Yes. So your first point of contact really is your OBGYN. And as I said before, I love that you're having these conversations with women, because that's where the conversation needs to start. And then hopefully your OBGYN can connect you with if other additional resources are needed. Counseling, talk therapy is one of the best things that women can do. Here's the great news. Postpartum depression, postpartum anxiety disorders are highly responsive to treatment, to counseling.
Yes.
So it's often about getting a couple of skills, addressing a couple of issues, and those things can then make a huge difference in the course of the disorder moving forward from that point in time. But connecting with a therapist is one of the best things, and the earlier that you do it, the better.
That's fantastic, Jaime. Thank you so much for all of those amazing tips. I mean, I think that one of the most important things that you said, and this is just me and all my goofiness, but there's a song that's like, walk it out. So talk it out.
Yes.
Talk it out.
I love it.
I think that's really, really, really important. And honestly, talking just makes you feel so much better about it. So you are like so amazing. where can we find you? If I need some counseling, I need to talk, where can we find you? Where can we come and see you?
Yeah, absolutely. So I'm in New Jersey, and we are lucky in New Jersey. We're really lucky in New Jersey because New Jersey is one of the best states for postpartum depression, both in terms of we are one of the very few states that does all the screening in the hospitals. And so for those of us who are in Monmouth County, we're also really lucky. Monmouth Medical has a postpartum depression, perinatal mood and anxiety disorder treatment program that specializes specifically in that. And I'm a part of that team there, very proud to be a part of that team there. And then I have a counseling practice myself, also located in Monmouth County. And on my website, I have a wealth of resources for women who might not be in this geographic area, but people can connect with me there. And then, I also want to say, because I'm sure there's people who are listening to this who are outside of our geographic area, Postpartum Support International will connect women with resources wherever you are, because that's what's really important. So no matter what state you're in, no matter what country you're in, there are providers, there are clinicians, there are people who are knowledgeable about this. So please, reach out and ask for help. And I'd be happy to help connect people with things wherever they are too. That's the right thing for them.
Because we certainly are our sisters' keepers.
Absolutely. And, we talk about mothering the mother because the mom is doing so much work caring for the baby, and the mom needs so much help too. And I just want to speak to particularly that idea of, I think moms are raising babies in isolation much more so than we're meant to than ever before. And so I also think that's part of why counseling really works too, is it is the connection. A lot of times new moms talk about being really isolated. They might have a partner that's home with them maybe for a short period of time, and then that person has to go back to work. Some moms are on their own. But counseling is an opportunity to connect in and of itself. And that's what I think moms need a lot of.
Yeah. I'm so old school, and one of the concepts from back in the day that I really appreciate and fall back on is it takes a village.
Correct.
We need to fall back on the village, because I feel like nowadays we've just lost that.
Yes.
We've really lost that. So, Jaime, in closing, I just want to, first of all, thank you so much for being a guest on the podcast. We certainly enjoyed having you.
Thank you.
And we certainly plan on having you back. You are now our friend.
Awesome.
I would like to thank all the listeners for tuning in to the Ask Dr. Angela podcast. Please continue to follow and show your love. Visit us at www.askdrangela.com. Our new website is amazing. You can find all the latest and greatest there with regards to women's health. You can check out the podcast, my weekly blog post, and you can access me through all of our social media networks. In closing, I would just like to say this. Women, we have, we can, we will. Women, own your being, be you. Whether you're a stay-at-home mom, a career mom, please remember and know that your contribution has and continues to be invaluable. Until next time, look better, feel better, be better. Can't wait to reconnect on our milestone 200th episode. See you next time.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.